hip pain in pregnancy, coming up next. So why do you have a lot of hip pain? Why do so many women in their pregnancies experience a lot of hip pain, hip issues, weakness in the hip, sciatica type symptoms? Well, it's actually a function of a hormone called relaxin and about how your muscles and how your body works in general. So I'm going to help you understand that piece because it's really important. So when you're going through pregnancy, that hormone that helps to soften up the ligaments and helps your pelvis to widen to accommodate your growing baby, that's a hormone called relaxin. And relaxin does just that, relaxes. It softens the firmer tissues, the connective tissues of your body to allow for these changes. Now, what ends up happening for a lot of women is they start having like really significant hip pain, or it feels like the hip's giving out, because as the pelvis is widening and shifting, you begin to lose a little bit of structural stability, right? Ligaments help your structure to be stable. When relaxin starts softening those stabilizing structures, now the muscles have to take up that slack that the ligaments were doing before. So what ends up happening is as all of those ligaments around the pelvis start softening, the muscles of the outer hips, which are called gluteus medius and gluteus minimus, their job is to stabilize the hip joints and stabilize those femurs in the socket of the hips. So they start to go, oh, I gotta work really hard, and they start contracting to try to kind of keep the pelvis stable. Over time, that contraction can turn into tension, which in my world is called trigger points. And trigger points in those hip muscles, or tension, or that gripping, trying to stabilize the hips, can lead to all kinds of symptoms: SI joint dysfunction, radiating pain down the legs, sciatica type symptoms, iliotibial band pain, you name it, hip pain, low back pain. All of that can be relative to those muscles of the outer hips gripping. So I've made a couple videos for you. The first one is to actually address the inner thighs, tension of the inner thighs, to soften some of that pull on the outer hip muscles, and then how to treat the outer hip muscles themselves to help alleviate these conditions of hip pain, hip dysfunction, and even some low back pain during your pregnancy. So relaxin causing softening of the ligaments around the pelvis and the hip joint, the hip muscles, the glutes gripping to try to recreate some of that stability. And we can use balls and a little bit of specific rolling practices to actually rebalance that system so you can feel the most comfortable you can and actually enjoy your pregnancy. Thanks for being here. To effectively treat yourself and get yourself out of pain, you're going to need a set of balls. And we use the FreeBody balls. You can get away with a tennis ball, but still I highly recommend that you have a soft ball because there's going to be some spots that are really tender. So we're doing self-trigger point release work to get you out of pain, and you're just going to need some balls nearby. So we're going to set this up now so that Morgan can release those inner thighs to get some ease in her outer hips. So laying on one side, I'm going to take the yoga bolster and just have it nearby for support. And then we're going to take the soft ball, really helpful to have that soft FreeBody ball, super important. And then place a block like that and put the ball on top, and then she's going to bring her thigh up and over onto it, and then the bolster is there, or it could be a stack of pillows, or it could be a stack of blankets. If you don't have a yoga bolster, although I highly recommend it, to support that bottom leg. And then for this, it's just more about kind of rocking. So Morgan, you can bend that bottom knee a little bit more, just bend it a little, and that kind of gives you a broader base of support. And then as I mentioned in the earlier talk, those inner thigh muscles go all the way up toward the pubic bone and attach along that inner pelvis. So eventually you'll want to get the ball as high up as you can, close to the pelvis. But that soft ball, especially when you're first starting to roll, is super important to kind of let the nervous system know that you're coming and not just blast through tension. How's that feel? Good. Great. And as you get up closer to the pelvis with the rolling, that pelvis gets those adductor inner thigh muscles kind of stack on top of each other. So you might find that you want a little bit more pressure there as you get closer to that inner thigh up by the pelvis. So some of those adductors stack on top of each other, those inner thigh muscles that are contributing to hip pain. And especially late stage pregnancy, you want to do some of this rolling. And as you get closer to the pelvis, you might want that firmer, larger ball so that you can get a little bit deeper. Now you also have the option to flip the block up and make it a little bit higher. But going from this height to the full height can make it a little bit shaky getting in there. So is it okay if I switch to this ball? So now we're going from that soft FreeBody ball to a firmer ball, and we're just going to sink the tissue onto there, and it's going to feel way more exciting, right? And so once you get that firmer ball in there, that's step 2, you want to just sink down. Let your body soften and relax in there. You will probably be surprised at how exciting that is to have a ball in that inner thigh. And you're going to find a lot of tenderness the closer you get up to the pelvis. So notice that we're doing this on the side so that baby has a place to be, right? So to get closer to that pelvis, we just scoot in as much as we can, get that ball way up in there, and then drop the thigh onto it. How's that? Yeah. It's okay for that firmer ball to be in there. And then you just sink and drop. Maybe a little tiny wiggle in your body, little tiny rocking, but really it's about that sinking through. And that's why it's really important to start with the softer ball. So you're not blasting through your nerves, but you're kind of getting things warmed up and ready for the deeper pressure with the firmer ball. And are you finding some tenderness in there? Yeah. And what you'll find is that the side that you have more outer hip pain, you'll probably have more inner thigh tenderness. So we're just going to let her sink in there. This is a pretty quick practice for this area. You're going to take just let yourself sink into that area. Take a couple of breaths here. See how much of the rest of your body you can relax. So can you soften your jaw and soften your eyes? And then now we're ready to move off of this ball and just do a little check and see if you're still able to lay on your back. You could go onto your back and do some windshield wipers. And I'm going to ask my friend Morgan to sit up and just come into a little wide angle, sitting right on her butt on the floor. We'll move that ball out of the way. She's going to sit up and stretch her legs wide. And we're just going to do a little test and see how those inner thighs feel, and does that right inner thigh feel any more free than the left side? Yep. And great. So now we want to do just a little bit of that on the left side. So she's going to lay now on this side, laying on her right side. And we're going to set her up with the balls. I'm going to hand you the soft ball. I'm going to hand you the block. Maybe you can reach in and place that. Yeah, so see how she just places that right in front, and then we'll place that here. And so now we're going through the other side, and I just wanted you to see this set up for more again. Starting again with the soft ball is really important. Starting about midway down between the pelvis and the knee, not going too close to the knee, coming into this spot, taking a few breaths here, maybe a little rocking back and forth with your body. And then you're going to work that ball in closer to the pelvis by scooting that block and the ball in. You can also play, if your belly is smaller than Morgan's is, you can roll a little bit more towards your belly, and that's going to help the ball get up higher to the pelvis. And then as you're rocking, just kind of noticing, and then sometimes you have to stop moving, allow the ball to sink down into the tissue. Is that a tender spot for you, Morgan? Yeah. And so you could go through this whole process again with that firmer ball. And basically, just a reminder, it's really important to release those inner thighs before you release the outer hips. So to release that gluteus minimus on the side of the hip to help with sciatica problems and hip pain issues, if you're very late stage in your pregnancy, you might need to start with that firmer ball so that you can get enough pressure, because you'll have a lot more tissue. If you haven't done this before, nice to try the soft ball first so that you don't shock your system. And Morgan's going to use this firmer ball. And you're going to come to sort of on your side so that your hips are off to the side. There you go. And then you drop in. Notice that she dropped that side of her pelvis onto the ball. She's not on the thigh. Okay? Keeping that bottom knee bent is really helpful because it creates a little more stability and makes that tissue a little softer so the ball can sink in. Keeping the top knee bent and the foot on the floor gives you a little bit of way to rock and move around, and it takes a little bit of pressure off the ball. So if Morgan dropped that right knee down onto the left, and feel how that adds a little weight to the ball. So that way you can add a little more or lift the knee up and off and take a little bit of weight off. And then Morgan, I'm going to have you play with like taking that top hip and rolling it a little bit forward. Yeah. And then rocking that top hip back and getting a little bit more toward the back of the pelvis with that ball. And so in that way you can explore the side of the pelvis and really working in those glute muscles that stabilize the femur in the socket, that stabilize that hip joint, into those muscles that create those sciatica type symptoms, hip weakness, all the things that we talked about a little while ago. And then if you want to go even deeper, of course, you can use that smaller ball. So it's always good to have all your tools nearby. You want to have that air-filled ball in case you've never rolled this area before and you want to check and see. And if you're earlier in your pregnancy, you won't have as much tissue on the sides of your pelvis. So the soft ball might be great for you the whole time. Switching to that larger, firmer ball might give you a little bit extra as you're ready and as you're carrying more tissue in your hips. And then if you want really specific, you can use that one smaller ball to get into the side, and that's going to get real specific. It's going to be the most exciting ball that you could use in this outer hip. So you just have to find what is best for you in your body. And as you know, in pregnancy, your body changes the whole pregnancy. So what works in your first trimester may be different than what works in your last trimester. How's that feeling? It's good. Great. So now you can go ahead and switch to the other side. And so I'm going to have Morgan kind of sit up off that ball, and I want you to show again, like see how she just kind of laid her pelvis down on that ball to come down, and then she's lifting her pelvis back up off the floor, off of that ball. And then you can go ahead and get the ball under the other side so that you're balanced on both hips. Releasing gluteus medius at the wall is really simple and super highly effective for alleviating all kinds of conditions. Restless legs, pain in the sacrum, hip weakness, a lot of issues that come up in pregnancy. So you definitely want to use your soft ball. And I'm going to ask Morgan to turn and face that back wall because I'm going to show you where these muscles live, right? So here's the sacrum in the middle of the pelvis, right? And then the top rim of the pelvis. So yes, it feels good to roll your whole butt at the wall for sure. But these trigger points that cause this pain and dysfunction live at the very top rim of the pelvis. So Morgan's going to be rolling along this top rim to alleviate those trigger points. So you want to start with your softest ball, that nice soft air-filled ball. And Morgan, I'm going to hand you the ball and you're going to step your butt back to the wall. And you'll want to begin with your butt at the wall and your feet just a little bit away from the wall. And just like any other rolling at the wall, the closer you stand to the wall, the less pressure. And the further you stand away from the wall, the more pressure you'll feel in the balls. So stepping your feet about hip distance apart or a little wider. And then she's going to roll the right side of her bottom. So she's going to turn a little bit to the right, keeping those feet a little bit wide apart. And so now, Morgan, go ahead and take that ball and place it on the top of your right buttocks, kind of near the sacrum. And then bend the knees a little bit, kind of play with like finding that spot. And then she's just going to rock her weight side to side. When you begin this work, shifting your weight side to side and just cruising along that top rim of the pelvis gets the tissues warmed up and kind of ready for more specific trigger point release. You'll want to do that for about 15 or 30 seconds to get the tissue ready for the specific release work. How's that feeling? Good, great. So now you're going to get that ball really close to the sacrum, just on the outside of it, what's called the SI joint. And Morgan's wonderfully keeping her hand up on her baby so that we can see where the ball is. You can just keep your arms relaxed by your sides. And then did you find a little specific spot? Mm-hmm. And so now you just kind of sink into it, relax your jaw, nice breaths. Breathing as deeply as possible, late stage pregnancy or any time in your pregnancy. And then just giving that trigger point, that tension, a little time to release. And you might start to feel it get a little bit softer, a little bit easier. And then there are kind of three main trigger points along this trajectory, along this line. So now you can maybe scoot the ball a little bit out to the right a little bit, and then you'll rotate your pelvis a little bit toward the wall. That's going to get that pressure about 90 degrees to the tension. Feel that got more specific, right? Just turning that, rotating that pelvis a little bit. Breathing. Check your whole body. Are you as comfortable as you can be in this position? Do you want to adjust your feet? Just making sure, that you feel well supported. Mm-hmm. And then after a few moments here, a few breaths, then just kind of moving up. Maybe it would feel good to kind of rock back and forth again, following along that trajectory of the top rim of the pelvis. And then for the last point, you're going to rotate your body a little bit closer, like toward the wall, and then readjust your feet so that both knees can be bent. You feel well supported. So we want her to be just not quite perpendicular to the wall, but just before it. What's interesting about this point is that the further away you get from the center of the pelvis, the more this pain radiates at the center of the pelvis, so right on the sacrum. If you're having sacral pain, feeling like you kind of got kicked in the sacrum or fell in the sacrum, this is the point that's really going to help with that particular pain, as well as all the other conditions that we've spoken of. How's that spot feeling? It might feel kind of good to just like bend and straighten the knees a little bit, kind of go up and down, making sure that you're right on the sort of apex of that tension spot right there. Good, right? Mm-hmm. So we'll just take maybe 2 more breaths here. And always just checking, can you relax the rest of your body and soften your shoulders, soften your jaw. Mm-hmm. And then to complete this side, you'll just go back and forth side to side, you know, kind of rolling across that top rim again. Great. And then I just want to see how this has affected the strength in either side of her hips. So Morgan, you're going to come away from the wall. Great. And then you're going to bring your hands to that wall back there. Okay, great. And then you just release that right side. So I'd like you to kind of take the right leg out to the side, just kind of a little bit of a leg lift out to the side, see how that feels, and then lower it. And just do that 2 more times. Lift and lower, and then lift and lower. Great. And then bringing your hands to that other wall, now bring your left leg out to the side and see if that feels so much lower, like a full foot lower, because she still has some tension in that glute med. So great, Morgan, thank you. So you're going to turn around. Let's release that other side so that you can be a little more balanced. So again, bring your bottom to the wall, rolling the left side. You want to turn your body slightly to the left, stepping in closer for less pressure, stepping in further away for more pressure. And then just cruising across that top rim of the pelvis, just to warm up that tissue. Back and forth several times. Checking your breath, keep breathing, not holding your breath. Sometimes the points can feel really exciting and spicy. So there might be a little like, oh, wow, there's something there. So just making sure that you release the breath and keep yourself breathing. And then now that it's been a little bit, you know, you can feel the tissue kind of starts to change. It's ready for the ball to go in more specifically. So you're going to get that ball right next to the sacrum. And then just kind of wiggle around a little bit until you find that real specific point. And I can see when Morgan gets it because she's like, oh yeah, that's it. Yeah. And then just a couple of breaths here. It's common to feel one side more tender than the other, and it's often the side that you're having more weakness on or more kind of hip issues on. You might feel more tenderness on that side. And then after a few breaths, now you kind of move your bottom back, bring the ball out a little bit more to the side, turn your body just a little bit more toward the wall. Morgan's doing a great job. And then you'll go, oh, there it is. There's like another spot. And you might have to go up and down a little bit to just make sure that you're right on that spot. Yeah, right? That helps, right? To just like, oh, there it is. I've yet to meet a pregnant woman that doesn't have any tension here in these areas. This muscle specifically is really working hard to stabilize the hip joints. And as we know, late in pregnancy, the hip joints get less and less stable. So these muscles end up tightening and working really hard, causing all kinds of issues. So now we're going to go to that third point, maybe rock a little bit around, start to turn your body almost perpendicular to the wall, but not quite. And maybe doing a little up and down, just making sure that you're at the top rim of the pelvis. And then finding that third outer point. Again, this one referring mostly right into the sacrum often. You may not feel those pain referrals while you're doing the work. You might, but you'll maybe be feeling it through the rest of your day or when you're trying to sleep at night. Maybe one more nice breath here. And then it's always kind of nice to do a little bit of back, side to side again. Great. And so then you'll come off the wall, and let's do that little check again. Let's see if Morgan's leg lifts higher. So go ahead and hands to the wall, and then we're going to lift that left leg up so much higher, like literally like a foot higher. The muscles, that just releasing that little bit of tension, already it makes them stronger and more capable of doing their job. Great, and so that's it. That's releasing gluteus medius.